Hi, welcome back to Visions for Health. I'm Wendie Trubow, and I have as my guest today Jeanned'arc Haddad, registered dietitian, and we're going to be talking about nutrition. Jeanned'arc, welcome. Thanks so much for being here.
Thank you for having me.
So talk to me, how did you get into nutrition?
Through my journey in college, I was going into pre-med. Realized I actually couldn't handle the aspect of having blood, or handle that, the gruesomeness of
the
that.
guts and the gore were a deal breaker.
Exactly. So I was like, oh no, I couldn't do that. I actually became an EMT, and that's when I realized I couldn't actually handle that aspect, and realized I still wanted to stay in medicine, but wanted to something that was little, less, gory. So that's where nutrition came in.
Got it.
And that's how I started my journey in
So you
college.
went to school, you got your RD degree, and then where did you wind up from there?
So from there, I actually went into clinical nutrition. So I worked at a hospital setting as well as nursing homes. And then from there, I actually went into, and while I was actually working at the hospital setting, I actually was able to have the opportunity to work in an outpatient setting, and realize I like the counseling aspect.
What does that mean to work in an outpatient setting? Does that mean that people, so they're not in the hospital, they come in, they have an appointment, and what do you do with that typical appointment?
So that's where I can do more of my counseling. So I can talk to them, counsel them on their nutrition aspect, and what to eat, what not to eat, and how to stay healthy. In a hospital setting, it's mostly you're in and out, prescribing a diet.
Yeah.
But there's really no room for counseling at that time, because the patient really just wants to go in and then leave.
So you're doing more acute issues in the hospital. You're doing how do you get the nutrition, the calories, the fat that you need in the hospital, but you're not necessarily doing what happens when you go home. Is that correct?
Exactly.
Okay, and then in the outpatient setting, you're doing, now that you're out of the hospital or now that you're here, how do we get you healthy?
Exactly. So,
Okay, and how long did you do that for?
So I did that for a clinical setting 2 years or so, and then after that I actually went into outpatient, and I worked actually in a diabetes center. So
Oh, interesting.
yeah, so I actually became a diabetes educator at that point, and I was able to spend my whole time counseling patients, which is exactly what I love doing,
Right.
which was great.
And then, now you didn't stay in that area, you transitioned to a slightly different aspect of being a dietitian. What happened? How did you get into, well, why don't you say what you do, I guess, because I have advanced knowledge, and then how you got there.
So going into the outpatient aspect, I knew I actually had a friend who actually was type 1 diabetic, and I was always just intrigued on how important her food intake was to her health. So if she just, she couldn't really cheat per se, because then she would either have a really high blood sugar reaction or really low. And, I always, we went to college together, and, I always had to have backup food for her, or just in case, because I was always worried that she might have a, hypoglycemic reaction in the middle of a test or an exam. And to me, that was just a natural transition, because it was so important. Food really affected someone with diabetes.
So you saw it.
So I saw, exactly.
Okay. And so you spent a couple years doing the outpatient, straight up counseling, how many calories, how much sugar. I mean, there's a lot of talk about sugar. Is sugar bad?
Is sugar bad? Sugar is bad in excess. So
What's excess?
So what's excess? If it's artificial sugar, so something that you add to your food, just be mindful. Don't, if you're going to have, let's say, a cup of coffee or a cup of tea, have a teaspoon or so in there, just enough to sweeten it, but not enough where it's so sweet where you're ingesting calories that are almost wasteful. So you want to be able to eat your calories during the day that are actually going to benefit you and nourish you,
Right.
which is important.
I always tell my kids, don't drink your calories, eat your calories.
Exactly.
And they look at me like I have two heads. But. So then what happened after counseling at I'm sorry, I'm assuming.
It wasn't Jocelyn.
It wasn't Jocelyn, okay,
No.
I made an assumption. So after doing the diabetes education, then what did you transition into?
So I actually, at that time, I actually was pregnant with my son. And, I took almost like a leave of absence to help raise him and, kind of just see him through those early years. And that's when things changed for me in the aspect of nutrition.
It's always different once you've had kids, I
Exactly.
think.
Everything seems to change,
Yes.
and your perspective on many things end up changing.
So how did it change you? What did you go into at that point?
So it was then where I realized my son, actually, once he was born, he was a very sick baby. So I think from day one, he was just very ill with throwing up, and, you know, he was just never well. He could, you know, nothing settled him. So whether I nursed or if we did, you know, the pre-digested formulas or anything like that, he was still very ill. And that's when I realized food in this case was actually causing more harm to him. So I realized, you know, I need to do something. And that's kind of where my journey started. Everything kind of started from there.
So how did you do this? Did you do trial and error? Did you do research? Did you go to see specialists? Like, where do you go when you realize, okay, there's a problem? And you're a nutritionist, and you might not have the tools you need.
Exactly. So I actually sought after many doctors, whether it was Children's or MGH, or, you know, I really looked into a lot of GI doctors and, you know, tried to help that process in the sense of I knew there was something wrong. Modern medicine couldn't, or conventional medicine couldn't pinpoint what was causing him to constantly throw up. I think one doctor actually told me that I was babying him too much. But
babying a baby.
Babying a baby, if that's possible. But he just never settled. I mean, constantly throwing up. Anything he ate never really stayed in. So I realized I needed to heal him. And I had to take it almost into my own hands because I couldn't find any particular doctor that would do the testing. And I knew there was, you know, from my training as a dietitian, I knew food could either be healing, so food could be medicine, or food could actually do more harm. So I just needed to find someone that would actually do the allergy testing for me. Not just allergy, but food sensitivity. Because we did the food allergy testing and everything came back pretty much negative except for one where he had an anaphylactic reaction. So that was an easy one. We knew exactly what was causing that particular.
So you did the skin prick testing?
Exactly.
How old was he when you did that?
He was 3 years old.
That's a really hard test to do on a 3-year-old.
It was. It was very hard.
Okay. You're brave.
I know, but I needed to find the solution. We needed to heal him, so I had to do at least what the doctors that I was able, you know, and that I sought out.
So you knew what not to give him from so you knew what not to give him so that he would not stop breathing.
Exactly.
But you didn't necessarily know what was making him vomit and not feel good.
Exactly.
Okay, so then what did you do? So you did blood tests?
So we did. So I actually sought out through a lot of research. I read lots of books, did a lot of research online, and found a couple of doctors that were more functional or integrative medicine. So I made appointments and we started from there. So they believed, I guess you could say, in my theory, that it was food sensitivities that were causing it. Because I would eliminate certain foods and he would be fine, bring it back in, but there was no, like I couldn't pinpoint it because it was just a lot of food that he was in.
There are a lot of foods.
Exactly, there's so many foods, so it's hard to kind of decipher which foods were actually causing him to be so sick. So it's from there that I really did a ton of research, studied, took courses, went to every talk there was about, you know, nutrition from an integrative or functional aspect.
So how did it change you as a nutritionist? Because, you know, I could imagine if you're looking at fat, calories, and protein and water, and now you're looking at food sensitivities, this is a very different approach.
Exactly.
Did you continue to belong at your other job, or did you sort of philosophize out, or was it just no longer a match?
It was no longer a match because the philosophy that we had prior, kind of my training was everything was diet, sugar-free, you know, artificial, low-fat. And learning and studying this type of nutrition, this kind of approach to nutrition, there was no such thing, and you can't heal a body through artificial means. So it's really eating whole foods and using food as a source of medicine. So yeah, I definitely stopped. You know, I couldn't work any longer in more of that type of setting because it wasn't my approach. It wasn't my belief, and I couldn't teach something that wasn't something that I believed in. So
it was too bloody.
It was.
So from what you're saying, it sounds like you've experimented with lots of what I'll call allergy-friendly diets.
Exactly.
So
you've gone the gamut, right?
I did.
Gluten-free, dairy-free, sugar-free.
Oh, we've done everything. Yes. So I've done every type of diet that was out there to see what really would help. And with these tests that we did, which was the food sensitivity test, we were actually able to see what foods were actually causing harm. Eliminated these particular foods and food groups, and he stopped throwing up.
He stopped vomiting.
He absolutely just stopped vomiting, and things kind of went from there. He was actually able to heal. So we were in the process of eliminating the foods that caused the harm, and then add in foods that are actually going to heal his gut.
So did you do this as a family?
We did it as a family, and then that's what I really went into more privately. So kind of once I really became very familiar and comfortable with all these different aspects of diets that are out there, such as gluten-free, casein-free, or the Feingold, or there's GAPS. There's a number of different types of diets that are out there that are available. With just each one is just slightly different. And we've done them. We did it all as a family. Everyone kind of had to do it to see really what it was like. Yeah. And it made such a huge difference, which was so great.
So your family was supportive of this, or were there people in your family who looked at you like you had two heads when you were saying, okay, we're going to stop eating this food? And now, when I say diet, to me, diet implies temporary.
Yes.
And so were you thinking of these things as temporary fixes, or were you just looking for what was going to make a difference?
I wasn't looking at it for more temporary. I was definitely looking at it for more a way of life, and just finding that particular meal plan that would best fit our family needs and individual needs.
So a program, people say, I'm on a diet, and I'm like, great, you're going to go off, you're going to gain all your weight back.
Exactly, yeah, diets, I'm never a big fan of the word diet. It's one of those taboo kind of temporary fixes. So it's more of a way of life, or a program that, their approach to food. And that's the biggest thing, is approaching food as a source of nourishing your body, as a source of healing.
So what do you say to people who look at you like you have two heads when you say, we're going to go on this program to see if this helps our son?
I'm lucky enough, again, privately, I think a lot of people they were at the end of their, road. They just really needed something to make them feel better. And a lot of them, especially with my explanation as to why we're taking this route, because I'm always a person that always asked why, even as a kid. I always wanted to know why something actually occurred. And I think what I do with my patients is tell them the why and the reasoning behind we're taking this approach, and seeing if it works. And it may not. So maybe going gluten-free, casein-free may not be the most beneficial for you. It could just, eliminate eggs, as simple as that. But again, it's not really knowing. If we don't have the tests to really kind of solidify that,
this is
they're
blood
just another two, exactly like the food sensitivity.
So it's a very easy, you go, you sit down, you get your blood drawn.
Exactly.
Sounds like you have to go to a special doctor to get this done.
You do, and that's what's so great about Visions, is that we have these doctors that have the same philosophy of really healing the body from the root up. Knowing, what it is that needs to be done to get them to heal.
So what do you tell people? So you're looking at the data. Sounds like you're really data-driven. You like data, you're going to get information, and then you're going to design a program for someone that they can eliminate a particular food from their diet. Why does everybody talk about gluten? Why does everybody talk about, it's like bad?
Yeah, it's a taboo.
Why?
I don't know. I think our society is so, we eat so much gluten, I would say. Our food supply is very heavily carb-driven, gluten-driven.
Yes.
A lot of our snack foods, many kids are not going to say, hey, Mom, can I have an apple or a banana or so? They're going to say, crackers and Pop-Tarts and, foods of that nature. But our food supply, I would say, is very highly processed. And the foods are very high processed. So a lot of people are just becoming
what's wrong with that?
Well, it goes into our system. It causes havoc, because our body's not made to eat foods that are so highly processed. So, I've had patients who said they go to maybe another country, Europe, for example, and say, I go there and I eat and I feel so good. But a lot of their food is not processed. They're eating the real stuff. They're eating whole grains. They're eating real cream. It's not diet per se. There's no preservatives in their foods. A lot of European countries don't allow your preservatives and additives and, those type of ingredients into their food. So they're eating real foods. So you have that small, let's say, small
piece of dessert that's made from real whole ingredients. So it's real fat, it's real, it's the real stuff that you really wanted, but it's a small amount. You eat it and you feel, I've satisfied that need. Where here, I think we do a lot of sugar-free thinking or diet type of food choices, and you're constantly wanting.
I read that the diet foods increase your blood sugar because your tongue tastes the sweet, your insulin pumps out, your pancreas pumps out insulin, and then the insulin works, your blood sugar plummets, and you start to crave food and you eat more, and that people gain like 10 pounds on average.
Yeah, on these diet foods, exactly. So, the biggest thing is, as long as you don't have any food sensitivities or allergies, have the real stuff, enjoy it, and then move on. Because I think that's what we're doing. We're always kind of wanting that creaminess, richness in, let's say, a dessert, but just choosing something that's really, again, made from whole ingredients.
Do you notice in your population, because you've now been in nutrition for a number of years, do you notice that there's more sensitivities occurring?
Absolutely. And
why?
I've read a lot of different articles and kind of people's theories as to why this epidemic, I would say, of food sensitivities are occurring. And I think, again, it's our food supply. It's kind of where they're coming from. Everything's so highly processed.
Well, gluten is more allergenic now, correct?
Exactly. Versus even then. But we used to eat things that were more whole. So our foods weren't so processed and bleached and chemical laden and pesticides and herbicides and things that are in our food supply now that our body's not able to process. So they end up getting stored.
Stored in the fat.
And they get stored in the fat. So
you're working with people also. So this is something we talk about a lot, is that if you have a lot of toxins in your fat, you won't lose an ounce.
Nope.
Because you have to lose the toxins first.
Exactly.
So you also do detox programs.
Exactly. So I always tell people, before you really want to get into, let's say, a weight loss program, we need to kind of cleanse your body, almost like scrubbing bubbles, you think, for the bathtub. So I always tell people, your fat cell should be nice and clean in order for it to actually kind of shrink, so to speak. But if it's full of toxins, it's not really able to do what it's supposed to do. So you kind of need to scrub them out, release them, flush it out of your system, and now you have a clean, almost think of like a clean tub, a clean health.
It's a nice analogy.
So, yeah, exactly. So once you're able to do that, then you can kind of move on into a weight loss program to help.
So how would someone know, short of getting their blood drawn, if they had a food sensitivity? How do they figure that out? And why would someone even think that a food sensitivity to, gluten and dairy and sugar, I think, are probably the main food stays for most people at most meals. So why would someone get rid of their favorite foods that are everywhere? How would they even know they had a problem?
So the biggest thing too is not saying eliminate, so we're just going to replace. So that's the biggest thing I tell people, because once you tell someone that you're going to eliminate a certain food group, then it becomes like, whoa, there's no way I can ever do that. I love my, pasta. But what I tell them is we can replace that particular pasta with a brown rice or quinoa pasta. So you can still have your pasta, you can still have your American chop suey. We were just going to replace one ingredient. And you're not going to notice a huge difference. In terms of detoxing, or whether or not, let's say they have a food allergy, for example, a lot of people complain of joint pains or eczema, psoriasis, acne, hair loss, those type of, clues that are causing this. It could be bloating. It's a big thing. I have a lot, or they feel full after they eat. So those are some of the questions I usually ask. Do you feel full after you eat? Are you bloated? And the answer is yes. So there's something just you're not supposed to feel this way after eating. If you're eating,
unless you ate too much.
Exactly. If you're at a food buffet, okay, well, that makes sense. But if you're eating just, your average sized meal, you shouldn't feel this way. And especially with the eczema, a lot of people say, I do have eczema, or I do have joint pains, and, these are the type of things.
So head to toe, people can have complaints. So basically, you're kind of saying anything is fair game.
Exactly.
What about fertility issues? I know this is a hot button.
Oh, absolutely. If your body's
not for you, but just in general.
If your body's inflamed, how can it actually, something as pregnancy is so complex. It's so amazing that it actually occurs, but it takes a lot for your body to actually become pregnant. And if your body's inflamed, how can it actually be ready to accept?
So women's issues fall into the category of possible food sensitivities. You mentioned hair loss or thinning hair. eczema. Does acne fall under the category?
Absolutely. Yeah, it's all inflammation.
So bad skin.
Gingivitis. Energy level is very weak. A lot of people say they're so tired, you know, especially midday, or they're just not as energetic as they used to be, you know, or
headaches?
Memory. Yep, headaches, memory loss, fogginess.
Brain
so
fog.
Brain fog is kind of the big thing.
So no body part is pretty much immune from a food sensitivity.
Exactly. I think there was a belief that there was this separation between the gut and the brain, and now we know there's actually a connection and things can actually pass into our brain.
I tell all my patients that, and they're all shocked when I say 80% of your serotonin, your happy hormone, is in your gut.
Yes,
and they say, what?
Yeah. So you got to fix this to fix, you know, what's up here.
Your gut runs your brain.
Exactly.
Interesting. So, okay, so people don't need a blood test. They don't necessarily need to see someone. Can they just do this on their own? Or do you recommend it? Do you say, you know, you need guidance?
So it all depends. If you're doing, let's say, a gluten-free, dairy-free, it's something you can definitely do on your own and just really track it. Track your feeling, you know, how you're feeling.
So what does that mean? That means like you keep a diary and you write down what you ate and what your symptoms are every day?
Exactly.
Okay.
So you could do something like that. I don't recommend doing, let's say, a detox program with supplements without the guidance of a doctor because, again, the repercussions that can occur. And it's not for everyone. I mean, some people can do a detox program and they're absolutely fine, but if you have underlying health issues that have never been addressed and you're trying to ask your body to detox using your liver, then it's not really going to be a good outcome. Okay, so definitely under the guidance of a doctor.
Okay, so detox is off the table for, you can do it at home and you're in the privacy of your own home, you need help. But eliminating particular foods, something. So so do you recommend that people go whole hog and do everything, or do you recommend people do stepwise?
You know, it all depends. Some individuals like to do kind of the whole gamut, and they will. So do kind of like an elimination diet and kind of start from scratch. So it's really individualized. So when it comes to gluten, a lot of people kind of just think it's just pasta and my bread and my cereals or things of that nature, but it's a lot more intricate than that. So you're going to find gluten in a lot of your food sources, condiments, you know, even medicine, you know, things, cosmetics. I mean, gluten is in everything.
I went to put some makeup on and saw that it had gluten in it and said, oh, all right then. Talk to me briefly about what are the things, so something might not say it has gluten, it might say it has something that is gluten. What are the gluten grains? Because gluten is a protein.
Yep. So you have wheat and rye, smelt, and there's even things like kamut is another one. Which
barley.
In barley, exactly.
Is triticale a gluten grain? I don't know the answer.
What was that?
Triticale?
So
I don't know the answer to that. I'll have to look that up.
Yeah, I have to look that up. Okay. I want to say that is, I want to say that's a gluten source, but I'm not really.
So there's a bunch of grains. So barley, malt, rye, wheat, spelt, kamut, and I think triticale, but I got to check.
Yeah, you got to check.
So there's a lot of things that contain gluten.
Exactly, and a lot of them are hidden sources. So they might advertise it, let's say, as hydrolyzed protein. So, of course, when you look at that and you think, oh, it's just hydrolyzed protein, you know, what is that? It actually can be derived from a wheat source or a gluten source.
I just read that the FDA, I think, is encouraging new labeling regulations. I just read this on Friday.
Exactly. I think it's when it came out to the public, which is so great. So, you know, for something to be labeled as gluten-free, it has to be 20 parts per million or less.
And that means someone had to test it, or?
So yes, so they have to test it. I think what I read and what I understand is that they don't, I mean, they're using the ELISA test to determine if something has gluten or not. But there's still some gaps that are not, you know, because the ELISA test still has some limitations, especially when something's fermented, for example.
Okay, so there's some nuances here.
Yeah, but it's still a step forward, which is so great, especially for patients that have celiac disease, where a very small amount can actually cause a lot more damage from the GI tract versus someone who's just really kind of doing a gluten-free diet because of a food sensitivity. You might not get the same GI distress.
How quickly would someone notice improvement if they had, you know, I could imagine if you're sitting at home and you're watching and you're going, oh my God, how would I get rid of that? I would personally go stepwise just because I would be overwhelmed.
Yeah.
So I eliminate a food from my diet. How quickly would I see improvement?
So,
you know, because I'm into now.
Yeah, exactly. How long does it take for me to actually...
Right? What time is it?
Exactly. And I think a lot of our patients say the same things, like how long does it take for me to actually see any benefits? What I usually tell my patients is that for dairy, it takes about a month to really get the antigens out of our system. And then for gluten, it takes really 3 months. You will see effects within maybe the first couple of weeks or so in terms of feeling better, more energy, less eczema, or some of these symptoms that you might be having or experiencing. But really 3 months to really get the, the best overall picture.
That's a long time.
It is, but just think of how long, you were suffering from, some of these conditions. So I had a patient, for example, who had eczema since she was young. And never, was on every steroid that there was.
Oh, the poor woman.
So she came to the clinic, did the food allergy testing, realized gluten was so high, she was really highly sensitive, not allergic to it. And she eliminated it through diet, and she's eczema free at the age of, she's in her 30s. So she was so excited. She was, she was like hugging and everything, because it's something that she was really dealing with for such a long, long time.
So
she was able to heal exactly through food.
So you get to change people's lives.
Exactly, which is so amazing.
So you get to make a difference.
Exactly, and that's what's so nice. Again, food as medicine, it's my philosophy, but again, I usually tell our patients food can be medicine, but can also cause more damage depending on the individual.
Right, you take too much of it.
Exactly.
Jeanned'arc, this was a pleasure.
Oh, thank you so much.
Thank you for coming on the show.
Thank you for having me.
Is there anything else you'd like to add?
Just to eat food, just to use food as a source of healing. So take in the food that you eat, and there's always some property in that particular food, whether it's fruits or veggies or whole grains, and know that these food properties, especially when put together, have a source of healing if taken properly.
Thank you.
Thank you.
Thank you for joining us for our session with Visions for Health. We'll see you again.